What's up, everyone? Hi, welcome back to my channel. My name is Brooke, and I wanted to make sure I jump on here today and make sure I connect with all of my peeps out here, because today is National Infertility Awareness Week, April 24th through the 29th. So, you know, today's an important day for me to be able to share with you how I think having the support through infertility is really, really important. Knowing that you're loved, feeling that you're loved, and just being able to exude love is important. So don't mind my makeup today. I'm trying something a little bit new and fun. So I have a little bit of glitter, and it's certainly before 5 p.m. and it's raining. It's really nasty out, so hopefully the weather doesn't get too loud. But anyway, so as you may have seen in my other YouTube videos, I have been going through fertility treatments for the past 6 years, my husband and I. So, you know, infertility is near and dear to my heart, and I'm here for you. Know that you're loved, and know that, you know, we could communicate through, you know, through commenting or email or any kind of method, just to so you feel the support that you need through this process. Because if it wasn't for me finding the support that I need to get through, it would have been a lot harder. So last year, well, the end of 2020 is when I found a fertility coach. I did mention that, and I think all the resources that fertility coaching gives is really essential for women going through infertility. And just know that education in this realm is really important, because a lot of times women don't know the ways to navigate through to get to their baby. And, you know, a lot of women don't understand their cycles and how often during the month you actually can get pregnant, because it's a really short window. You go through your ovulation, you get all the kits, and you do the timing, and you track your cycle and your temperature and your fluids, but your actual time to get pregnant. So women still get pregnant naturally. So I may have mentioned in other videos, I'm actually today 43. So I am what the medical industry considers advanced maternal age. So, but you know, even though my husband and I already have kids, we were married after we had our kids, and we want to complete our family. So, you know, it's still within reach for me to obtain, you know, to make our goal of creating a baby and birthing a baby. So infertility for us has, you know, had so many struggles, but what I have done to get through with the support that I received is focusing on my mindset and finding new habits that actually make me, you know, be able to make it through my day a lot easier when I'm going through hearing bad news about my fertility journey. You know, right now I'm in a waiting period, so it's like, you know, you have to have patience, you have to have hope, continue to have love, and affirm to yourself that what you are manifesting, which means you are preparing for your baby, is going to happen. So just know that if you know, what you attract will find you. So we're not going to chase it. We're just going to attract our baby and invite our baby to come in. And we don't have control over when our baby comes, or babies come, but just know that we're going to keep working at it and find the answers to get us closer to our baby. So it's certainly taken me a lot longer to find the answers and for everything to align, but it's all in the right timing. You know, I believe that I am here at this place at this time for a reason. So knowing that now, 6 years later, if I were to look back, you know, in my second year in, whereas I would be looking at so many years ahead, going through just knowing that it's all in the right timing. So I'm glad that I have the strength to get through it and push through, but it's hard, and I know that, and a lot of tears and a lot of, needing to pick myself up off the ground. So Infertility Awareness Week, and being triggered by seeing other women pregnant, and that's the thing, even with secondary infertility, which is what I'm categorized as secondary infertility, because I have kids, I have birth kids, but since I have not been able to fall pregnant with a complete pregnancy, I'm categorized as secondary fertility. So it's still very, very hard. But the good thing is, take it easy on yourself. Know that you're human in your body. Just believe your body can heal. Your body can do it. And just support your body through the process. So know that in the end, whatever you're doing to support your body is the right thing. And trust that and know that. So those are things that I continuously affirm to myself. I find the confidence to, make those phone calls to my nurses and ask questions that I think, they might be saying, oh, I feel like it may sound stupid, but there's no stupid question. So it needs to be answered just so you can feel assured you're doing the right thing, or you're taking your medication at the right time. Right now I had to get blood work for my thyroid, and my thyroid levels are still low. And my endocrinologist did not actually review my results yet. So I emailed her through a portal and asked, could you review my results and let me know if I need to make any changes? So, and if I have a follow-up question, those questions are still important, because that affects, my overall health. As you know, your thyroid is very important, your hormone level, your metabolism. So, and that's all connected. So, I do want to make another video just to go over more of what my routines are, my daily habits, which have certainly made a difference in my day. As you know, your daily habits create more of your lifestyle. So that's why I've said to so many people that I've actually changed my lifestyle, because I've changed so many of my daily habits. And those daily habits have certainly helped me to feel as though I'm healthier and making the right decisions for my body and supporting my body. So so I just wanted to make sure that, if there's resources that you need outside of what you have, what I do is I listen to podcasts pretty often. I drive a lot, and I always pop on a podcast that's related to, whether it's something that has come from my fertility coaching program, or many of the doctors out there, or even just women that are going through infertility have podcasts. And you take everything with a grain of salt that applies to you, but a lot of things are uplifting, and a lot of people are going through the same thing that you are, of course. So it's just good to hear, that you're not alone, and that how other people are getting through it just like you are. So maybe some of their ways of managing it will help you too. So that's why I love listening to podcasts. It's just another media to listen to. Connect with other women or men, or doctors, or just people that are nutritionists or holistic. I really like to lean into things that help me, that I wasn't aware of. There's so many foods that I could eat to support my body, and herbs, and I just learned about lion's mane, mushrooms, and using shiitake. I just wanted to know more about what these things are doing to help optimize my bodily function. So it's been great. It's great to learn about all these different, sometimes it's Chinese medicine. I want to know what does the East say? What do these people do over in the East, where we live under Western medicine, which is completely different than traditional Oriental medicine. So I want to hear about all those different methods that other people are using, just to see how it helps your body and how it supports your body. So, and that's really what we're doing. We're helping to support our body through the infertility, because as you know, your menstrual cycle is your 5th vital sign. So, you know, a lot of times we find that if you go to a particular doctor, they'll tell you that if your menstruation is off, you know, that's, you know, if you're missing your period, or if your period is really heavy and clots, a lot of, you know, big clots, or more or less it's irregular, you know, all of those things, you really want to support your body in helping it get back to a normal cycle, where you're not having those painful periods and cramping. And, you know, even with me having endometriosis, you're supposed to have more painful periods. So that's not one of my symptoms. My symptoms used to be irregular periods, but they did certainly normalize their way out. But women a lot of times not aware of what they're eating and how your hormones affect your cycle. So that's a big consideration if you're trying to get pregnant naturally, or even through going through IVF. Your cycle is really important, because you know that's the beginning of when you start your stimulation drugs usually. So you want to make sure your cycle's coming on time and it's not irregular, or it's not causing you so much pain where, you know, you're not able to function. And if those things are happening, you want to be able to look into that and make sure you can clear all of that up. But right now, with my infertility update, I am waiting for my fertility clinic to call me and schedule a hysteroscopy. So the hysteroscopy is a surgery where they go into your vaginal cavity and just make sure it's perfect for the transfer. So my doctor is really leaning in towards making sure that after they did the D&C, that my cavity is nice and doesn't have any leftover tissue or adhesions or anything. If anything needs to be cleaned up, she wants to make sure she does take a look at that. So I'm waiting, and I guess they're really backed up because it's been like 3 weeks. I'm still waiting for the phone call to get scheduled. So they'll probably schedule me sometime in May, and then once I'm all clear for that, I can look forward to start my stimulation drugs. So fortunately, things are going to progress very soon. So that's, you know, where patience comes in. You're waiting for your next step. So you need patience. Or sometimes you're waiting for your follicles to grow, or sometimes you're waiting to ovulate. So it's all in the natural process. So and going through my D&C, it was 3 weeks I was bleeding. I was like, you can just see how your body has to take the time and actually go through that healing process after the surgery. And it's removing the tissue just like it did. You know, after the D&C, you're bleeding and bleeding, your tissue lining's coming out just like you would during your menstrual cycle. So it took a while. And I was patient and easy on my body, supported my body. And sometimes I just lean into what my body's craving. You know, I was craving a salad the other day from Sweet Green, because that's when I just started my menstrual, so I was craving beets, and I just wanted some really fresh, good food in my belly. So that's what I leaned into. And sometimes I'm craving chips. So I'll lean into, you know, having a handful of chips. But I certainly try to, you know, find chips that are not cooked in conventional seed oils. I do try to find chips that are cooked in avocado or coconut oil. I'll try plantain chips. Those are really, really good. So yeah, I just lean into what my body needs. But yeah, going through infertility, back to that, it's certainly something that you want to have the support to get through the different phases where you're feeling down and you're feeling hopeless. But just know that there is hope. And the hope comes from knowing and believing that you will get the answers you need to move forward. Whatever direction that is, that moving forward is, you'll get those answers. So that's the hope we lean into. And that's the hope that has kept me strong. So my beliefs, and that's why, you know, my daily habits have been really important. So I'll certainly make a separate video. I'll stop here with my infertility support, and know that if you want to reach out, if you want to know what fertility coach I'm using, or if you want to know how you can be supported or what I do to support myself, I'll certainly give you a list of resources that I do, or just a list of things that I do if you would like. But just know that you are loved, and feel that you know, you can lean into knowing that other women are going through this with you, and we can do it together. All right, so take care, and I'll see you next time.